they have to meet all three of the following criteria. First, they have to be feeling better. Second, they have to be fever-free for at least 24 hours without fever-reducing medicine. And third, they have to have a negative COVID PCR test result. This state mandate makes sense, especially in counties like ours who have a higher rate of transmission. But practically speaking, this requirement is keeping a lot of kids without COVID out of class. Kids who are feeling better, whose symptoms are gone, but because of the high demand for PCR tests and the lab time to process the results, they are unfortunately still staying at home. Even though we are in the middle of a pandemic, we can all agree that we want students who are healthy to return to school as soon as possible. It's for this reason that we are working to provide students who are ready to return to school with access to a rapid PCR test in their own school. That will look a little different in each school or in each district, but participating schools will be notifying their families to let them know they're offering these tests and explain how families can use these services in the coming days and weeks. This is a voluntary service on the part of schools, but I have invited all schools who are interested to work with my office to request a machine and the training on how to use them. We are currently still finalizing everything, so I don't have a definitive list of all of the participating schools at this time, but I do think parents should expect that information will be forthcoming in the coming days or weeks. Switching gears a little, I have another message primarily for our parents in the community. As you are aware, we anticipate the Pfizer vaccine will soon be available to children as young as 5 years old. This is very good news, and I know that many parents are eager to get their children vaccinated to protect them and others from COVID, especially now as we enter the colder months and the holiday season. I also suspect that most parents will want their children to get the vaccine at the same place their kids get all of their other vaccines, which is usually at their own family physician's or pediatrician's office. While primary care offices can directly order the vaccine, and some already are, they are all very busy right now. They are seeing a significant rise in calls and visits for acute illnesses, including COVID. For this reason, Monroe County is working with our primary care offices to order the vaccine. When it arrives, we will distribute it to individual practices so our community is prepared when the vaccine is fully approved for this age group. So, if you are hoping to have your child vaccinated at your own doctor's office, please know that we are working hard to ensure that this is an option for as many of you as possible. And yet, there will be practices who will not be able to directly provide COVID vaccines just yet. And so we are also working to help patients at those practices with additional options across the county to obtain the vaccines too. But as a family physician and on behalf of my colleagues, I ask parents to please be patient. There are a lot of logistics that make the process a bit more challenging for the vaccines for the 5 to 11-year-olds than the process that we're used to for other vaccines. Therefore, unless you hear otherwise from your own primary care physician's office, it is still premature to try to start scheduling appointments for 5 to 11-year-olds to get their vaccine. I assure you, however, that we are putting the pieces in place to roll this out as quickly as possible, and we will let you know when and where you can go when the time comes. By then, the vaccine will have undergone the same rigorous study as every other vaccine your child gets. It will be as safe and as effective as every other vaccine that your child gets as well. The dose will be smaller than that given to our teenagers and adults, and it does appear that most young children will have fewer or milder side effects compared to teenagers and adults. The common side effects will again be fatigue, fever, and headaches. As with all vaccines, severe side effects are extremely rare and don't even come close to outweighing the benefits of protecting our children and our community against this virus. So before I turn things back over to Julie for questions, I want to take this opportunity to thank Mrs. Marshall's first grade class at Lima Primary School for inviting me this morning to read to you and to talk about microbes. This is the book that they gave me today, and I wanted to send a special shout out to the students there and their families and their parents. Thank you for inviting me to read with you this morning. And with that, I will turn it over to Julie for your questions.
Thank you, Dr. Mendoza. First question comes from Spectrum News. Do we have a reporter on from Spectrum? All right, we're going to go on to WATC. I think Jennifer Mobilia is on.
Yes, hello, can you hear me?
Yes, we can, thanks.
Awesome. Okay, so I am curious, You're talking about these PCR rapid tests for the schools. Can you elaborate on what this means for parents and for the local physicians?
Sure. What this means is that our children who are ready to go back to school can get back to school as quickly as possible. One thing that we've seen over the last several months was with the New York State mandate that a PCR is required for children who had experienced COVID-like symptoms before they can go back to school, or before there's a different diagnosis. They need to receive a PCR test first. And the availability, low availability, and the challenges of receiving a PCR test were keeping children out of school for days when really they were fine to go back to school and ready to go back to school. So what does this mean? By having more PCR tests ready and available and free of charge to families, it means that children who are ready to go back to school can get back to school. They can go back, be with their classmates, and they can go back to learning. Parents can go back to work and don't have to stay home with their sick children. And we can get the economy moving and kids back to school where they belong.
Do you have a follow-up, Jennifer?
Nope, I'm all set. Thank you.
Okay. Next up is Patty Singer from Minority Reporter.
Hi, thank you. I'm curious is why Monroe County still remains so high in transmission compared to other New York counties. We continue to be red and yellow in those measures. What's going on with that?
Well, I'll start first by reminding everybody that for the better part of the prior surges of this pandemic, we've been a little delayed in terms of entering the surges. And as a result, we're also typically delayed in getting out of the surge. I know everybody's eager to see us get out of the surge and see the numbers go down, but I am reassured that numbers are not increasing at this point. There's really no evidence to suggest that. And they are, I think, decreasing slowly, but perhaps not as quickly as people would like. So I just remind everybody, the way we get out of this, the way other parts of New York State have gotten their numbers down is by taking all the precautions that we know about. Getting the vaccine, wearing your mask, and being thoughtful about those social gatherings, particularly indoors.
I don't know if the county executive wanted to weigh in on that before I had my follow-up.
I'm sorry, Patty, I couldn't hear you.
I don't know, did you want to weigh in on that, Adam?
Oh, no, I don't really have much to add. I mean, it's what we talked about every week. It's, we're usually just a little bit behind where other counties are going into a surge, then coming out of a surge. But, if you look at other like-sized counties in New York State, we're, in upstate New York, we're all pretty much aligned and in the same position right now. We're all pretty much hovering around that, on the CDC's website, you can look it up. We're all pretty much hovering around that 200 number of cases per 100,000. And so, hopefully it starts to go down soon. One thing that is encouraging to me is that we didn't have a dramatic spike, though, like a lot of our counterparts did. If you look down at the experience on Long Island, we can look down the thruway at Onondaga County, some other places down in the southern tier, their numbers actually went up quite a bit higher. They spiked higher than we did, and then they started coming back down. We had more of we got up to around this 200 number, 225, somewhere around there, and have really been pretty level for the last 2 or 3 weeks. So hopefully that's an indication that we're at the top and we start to come down in the coming weeks. But Patty, I'm just going to take this opportunity to also remind folks, holidays are coming up. And, we all want to get together again with our families. We want to get together for Thanksgiving in just a few short weeks away. Now it's time to get a vaccine. We know that the vaccines work. There's time between the vaccines. If you get the Pfizer or Moderna, Johnson & Johnson's a 1-dose vaccine. So now's the time to be thinking about if we want to travel and be with family and do so as safely as possible. The best way to do that is to be vaccinated.
My follow-up on that is talking about the incentives.
Sure.
How have previous incentive programs worked? How do you think this one will work any better? And when does it become really a bribe at this point, and people who've gotten vaccines and wanted boosters and saying, hey, I just went and did the right thing. Now people are getting incentives, bribes, whatever. How well do you think that this is going to work?
Yeah. So we've been tracking how previous incentive programs work throughout the year, and this isn't new. These go back into the spring, different types of incentives have worked in different ways, from tuition that the state had offered to gift cards. The county was giving out small gift cards. And what we found working with our partners at the United Way and other community-based organizations and generous donors just a couple months ago is that this is right about where it works. It gets people's attention and draws people in who might not otherwise be interested to have the conversation. Okay, and that's what we found in a lot of community-based clinics is that the incentives were really driving people in, have a conversation about why the vaccine is important to them, how it would work, and whether or not it's the right thing for them to do. We chose to go the $50 route for the first dose and $50 for second dose to ensure, though, the maximum public protection to make sure people come back and get that second dose, which is required to be fully vaccinated. So we chose to go down that road, but the data was pretty clear the last time that this type of incentive was offered several weeks ago, that they saw a pretty dramatic increase in the number of people coming in and having that conversation and choosing to become vaccinated. So we got to follow the data and follow what works. This is what works. Also, again, this program will go right up until about Thanksgiving. And I think this is a great time to remind people to come in and a great time to reach people who we haven't reached yet to have that conversation, because we're going to be having large family gatherings again and community gatherings as we get into Thanksgiving. And we want to make sure that we, everybody is as safe as possible. And the best way to do that is through vaccination.
Thanks.
Thank you, Patty. Natalie Kuchko from 13 WHAM, you're next.
Hi, everybody. Thank you. My first question is for the rapid PCR testing. We understand that the pilot program has been underway. So I just want to ask, what was learned from that to take away as we begin to roll out these tests within schools?
So we're piloting the testing program now in just a handful of schools. As you can imagine, our school nurses are very busy right now. And so the piloting really was on the side of the schools, trying to figure out how to operationalize having the students coming down to the nurse's office, working the testing process into the usual workflow for the school nurses, obviously working with parents as needed about the results and permission and so forth. So there were a lot of logistic things that needed to be ironed out for this. The actual test machine is relatively straightforward for most people who have some lab experience to operate. So I think the pilot really was to make sure that this was acceptable and as convenient as possible for our schools and their school nurses.
All right, thank you for that. And then I just have one follow-up, unrelated. I just want to ask, are we able to get any update on the backlog within local emergency rooms? Any conversations that are being had with our hospital officials at this time?
Yeah, I don't have an update in terms of numbers that are in the hospitals. I direct you to them, but we continue to have conversations. We just met yesterday to have an update on the situation, and it really remains pretty unchanged. And it was reported back that things are fairly stable at this point, as they've been the last couple of weeks in the same condition. Like I said, I think that I've been saying this for weeks now, but I think the key to moving this along and moving patients through the hospital systems is to be able to get nursing homes stabilized and more staff in nursing homes. We've got to be able to provide beds for people to get them out of the hospitals where they don't need to be into a facility that's more conducive to the care that they require. And so we really got to incentivize nursing homes. Monroe Community Hospital has been doing a fairly good job, or actually a very good job, in that we were able to start taking additional patients last week. But we got to keep our foot on the gas pedal when it comes to that. And also, there's getting into the career of healthcare. I want to thank all the healthcare workers that are across this community, but now is a great time to consider a career in healthcare. We have CNA training positions and things of that nature that stand ready to help people get into the field if they're looking for work. But that's really, I think, where the focus has to be at this point, is on how do we stabilize nursing homes and add staffing levels to them. And that's what we're looking for assistance on.
All right, next up is Raquel Stephen from WXXI.
Okay.
Thank you, Julie. Good afternoon, gentlemen. I guess my question is kind of off topic, but since County Executive brought up Monroe Community Hospital, do we have any word on the county and the relationship with Fresenius? Have we talked to Fresenius, and how are we moving forward with the dialysis issue at MCH?
No, thank you for asking. Yeah, we've had additional follow-on conversations since I made this announcement before. Right now, all our residents who live at Monroe Community Hospital who require dialysis services, we've been able to arrange transportation for all of them so that they're receiving dialysis services. But I'm going to also say this, and I said this to Fresenius representatives again since last week. The condition right now is unacceptable. And this is not a result simply of the vaccine mandate. This is a choice that a company is making that is disadvantaging people in our community who have limited access to transportation and who have chosen to live at Monroe Community Hospital because of the access that they have to that level of care. So I'm going to continue my efforts to advocate for a new solution. There was some indication that they'd like to work with us and hopefully be able to resume services there in the coming months, but I think months is too long. But we're going to continue to advocate for our residents there.
Thank you, County Executive. And I guess my other question would be, as far as which schools do receive these PCR test kits, what are we basing that on? Is there any requirements that we're basing it on? What do these schools have to receive these kits?
So this is really an extension of the rapid antigen testing program that we've had in place now for over a year. The testing is a little bit more complicated, so we are providing training, but again, this is voluntary, and so we've invited every school in the county to participate, and schools are now weighing the benefits of trying to do the testing against all of the other needs that they need to consider as a school. But at this point, it's really first come, first serve. We are going to try to be sure that we're equitable as possible in distributing these test machines. I do know that schools are looking at different models. Some schools are looking at ways to do this during the school day. Others are looking at ways to do it after the school day, largely dependent upon staffing and other logistics. But we're working with all the schools to meet them where they are and figure out what works best for them. But we want to make sure that we're focusing primarily in the city where we know that the vaccine numbers are a little lower than the rest of the county. But beyond that, really as equitably as possible across the entire county.
Thank you, guys. Great information. Appreciate it.
Mm-hmm.
Thanks, Raquel. Brian Sharp from the Democrat and Chronicle is next.
Yeah, I was wondering, staying on the schools and the PCR testing, and I know you're just rolling that out, but is there either a time frame that you've given schools to reply, or just trying to get a sense of when this might be available?
So the test machines came in earlier this week, and so we yesterday asked them to reply back to us as soon as possible, I think by the end of day today, with their request. We're going to look at all of these. We know that we're scheduling appointments to do the training as we speak, and they'll be available to pick up, I think, next Wednesday. So we're looking to roll this out as quickly as possible.
Thank you. And I was wondering also on schools, a couple of weeks ago, we talked about just the voluntary testing, random testing that was being done, and that you would have a sense in a couple of weeks of what the compliance was with that for parents who said they didn't want their kid to participate. Do we have any sense of what that looks like and how that spreads out across our region?
Yeah, Brian, I don't have numbers to give to you at the moment, but I do know in my meetings with the schools that the testing is ongoing. They're offering testing to unvaccinated students, and they are testing those unvaccinated staff. So it's ongoing. I'm not aware of any hiccups or issues, but you'll have to ask the schools if you are interested in more of the details.
All right. Do we have a reporter on from WROC? Okay, I think that's it for questions today.
All right, great. Thanks, everybody. Have a good rest of your day.
Thank you all.